I got pregnant. Initially felt really well, and we were on holiday in the US visiting my husband's family, and literally overnight, and this was at 5.5 weeks,
Oh, wow.
I started feeling extremely unwell. Everything set me off in terms of nausea and vomiting, and I literally could not stop. I
Gosh.
literally couldn't keep anything down. I couldn't even keep a sip of water down, and
Yeah.
the nausea was so horrific. Went to the GP, who said, "Oh, I think this is Hyperemesis Gravidarum." I was so ill, I can't actually really remember much of this, but she did a urine sample test for me and concluded that, it was not good.
Yeah.
Gave me a pill that I tried to swallow and, of course, immediately vomited up again. But the rest of the pregnancy, I was still severely unwell, and the smallest thing would set me off. I didn't have a life. So obviously affected me greatly from a mental health perspective. I had severe pregnancy depression that was completely undiagnosed. And after my daughter was born, I also spiraled into severe postnatal depression and anxiety. They're quite common with women who have gone through hyperemesis.
Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune in to what really matters: your body, your well-being, your life. No one-size-fits-all advice, just real conversations to help you understand your health on your own terms. But before we dive in, I have a quick favour to ask. Please hit subscribe and join the 51% community on our website. It's free and it helps us grow, reach more women, and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared on this podcast is for information only. It's not medical or financial advice, and always speak to a qualified expert for support. Karin, welcome to the podcast. It's great to have you on. Can you introduce yourself and talk a little bit about your journey from what you were doing to what you're doing now? And also we're going to delve into your kind of lived experiences of various health conditions.
Yes. No, so first of all, it's absolutely wonderful to finally be doing this because we've been talking about it for a while.
Yes.
And some of the health issues have kind of delayed this thing actually happening. But so I'm Karin and Thyselius, and I am originally Swedish. Came here in September 97 to study singing at Guildhall School of Music and Drama. And I thought I was just going to be here for 4 years, and ended up going on to do more studies at the Guildhall. Was there for 6 years. Then started working as a professional opera singer, and was doing that, the full time essentially. And I met my husband, well, now husband, rather, in 2004. And we got married in 2007. And we actually had to schedule the wedding in between opera engagements. So I was back to back going from one opera production to the next. So it was not so easy fitting it all in.
Yeah.
But we found a time during the summer of 2007, and a couple of weeks after that, I went on to work with Scottish Opera. So I was living up there for a few months, rehearsing, and then doing lots of performances. And I remember my husband, just after we got married, we had talked about, having children and so on. And he was quite keen. He's a little bit older than me, and he was quite keen to essentially start trying immediately. And I remember saying to him, which is kind of interesting when you know the full story, that maybe just let's hold off for a second, because I'm just going into doing this really big job. And when you're pregnant, you never know how quickly it's going to happen, but if it happened really quickly, you just don't know how you're going to feel. And did the job, and in summer of 2008, I got pregnant. And initially felt really well and thought, oh, this is going to be a breeze. And we were on holiday in the US visiting my husband's family, and literally overnight, and this was at 5.5 weeks,
Oh, wow.
I started feeling extremely unwell. And from then on, I couldn't, everything set me off in terms of nausea and vomiting, and I literally could not stop. And we had booked this special sort of trip just for the two of us after seeing his family in Vermont. And I literally couldn't leave the hotel room for pretty much the entire week we were there. I was just vomiting. And it was nonstop. We flew back home, and I remember asking, or rather my husband was, he asked the flight attendants for sick bags.
Yeah.
And we hadn't even taken off, and I vomited the entire flight.
Oh, wow.
I
Gosh.
literally couldn't keep anything down. I couldn't even keep a sip of water down.
Yeah.
And the nausea was so horrific. We got home, and I mean, I vomited immediately after disembarking from the flight, at the luggage carousel, on the way to Heathrow Express, on Heathrow Express. I was so ill I couldn't even disembark Heathrow Express. I mean, it was like a joke. And so this was between 5.5 and 8 weeks or so. 9 weeks, 10 weeks, sorry.
So you just carried on without, did you see anyone? As in
Oh, yes,
a health
thank you.
professional?
Yes. So eventually, well, the thing was, all the books. So I had a pregnancy book,
Yeah.
and all the books say, you may feel nauseated and
Yeah.
vomit.
Mm.
And I just didn't really realize that this wasn't actually normal, because I just thought that this is what maybe people, women go through when
Yeah,
they're
why
pregnant.
would you? Yeah.
And then I'd have a day or two sort of interspersed in all of this, where maybe like for an hour or two, I'd feel a little bit better. So there was always this thing of, oh, but it's I did feel a little bit better, so it's probably going to go away. Went to the GP, who said, oh, I think this is Hyperemesis Gravidarum. I was so ill, I can't actually really remember much of this, but she did a urine sample test for me and concluded that, it was not good.
Yeah.
Gave me a pill that I tried to swallow, and of course immediately vomited up again.
Gosh.
And then ended up collapsing at home. And our neighbour then, who was a GP, my husband in desperation, terrified obviously, knocked on his door, and I then was admitted to hospital, and was in hospital for almost a week with drips and everything. Then got out of hospital, continued to vomit. Literally, I was vomiting for longer during the day than I wasn't vomiting, if that makes sense. I would wake up at night to vomit.
Wow.
When my eyes were moving, I vomited because of the movement. If I would be looking at you and you would be moving, that would be enough to set me off.
Yeah.
But the smells, I remember several rooms away from the kitchen with the doors closed, I could smell the bin. The smell of the contents of the bin with the bin closed. I could smell the metal in the pipes when having a shower.
Oh, gosh. Wow. So your senses were really
I was
heightened.
like a bloodhound.
Yeah.
No, I mean, I laugh about it now, but it was absolutely horrific. I had to be admitted a second time. And yeah, the whole pregnancy, I was on a cocktail of drugs, and I sort of, everything got under control-ish around 26 weeks. But the rest of the pregnancy, I was still severely unwell, and the smallest thing would set me off. And I didn't have a life.
Yeah.
So obviously affected me greatly from a mental health perspective. I had severe pregnancy depression that was completely undiagnosed. And after my daughter was born, I also spiraled into severe postnatal depression and anxiety,
Mm.
which I have learned since are very common, both the pregnancy depression and postnatal depression, and all sort of postnatal mental health challenges
Yeah.
are they're quite common
Mm.
with women who have gone through hyperemesis. And
Do you know the stats for that? How many women have
I
get in terms of percentage roughly?
No, I don't, but I think it's quite a high stat, I think,
Yeah.
but I don't wanna give anything because I really can't remember.
Yeah, yeah.
Um, but yeah, it's absolutely horrible.
And it sounds like, you know, when you were going through that, it was almost like there was no cure or
Yeah,
there was no solution.
yeah,
You know,
yeah,
you were put on drugs, but that didn't work.
yeah,
So it's almost a
yeah,
case of, well, why are you on the drugs then?
yeah, yeah,
Because you're you know, you're still throwing up as much as,
yeah,
you know, you
yeah,
were before. So
yeah,
why are you even taking the
yeah.
drugs?
No, exactly. Um I think it's interesting because the drugs they do make a difference if you're able to find a drug or a combo that sort of works, but you can still have months of, if not the entire
Yeah.
pregnancy. And I was very lucky, all things considered, because there are women who end up with kidney failure and all kinds of
Oh
things.
gosh. Yeah.
And I know some women who've they've been. I have maybe been in some cases more ill than they were, but
Mm.
I didn't have any sort of secondary
Yeah.
issues, like, kidney issues or anything, for instance. I was
Mm.
very lucky. I had problems with my gum and my teeth as a result of all the vomiting.
Mm.
But I was very lucky, like in other physically in other ways,
Mm.
compared to a lot of other women. And for some, it's absolutely horrible because for some women, they end up having to actually be admitted for a very long time, and some have the is it called a TP? They get fed through a tube.
Oh right.
Um,
Okay. Yeah.
um,
I'm not
I
sure
can't
what it's
remember what
called,
it's
but
called
yeah.
now. But yeah, it's
So it's like a liquid diet, really,
yeah,
isn't it?
yeah,
Yeah.
yeah, and
Yeah.
then obviously with the IVs as well, and
Yeah.
yeah. I mean, yeah, no, it's not a fun thing to go through, and
Yeah.
um, I did go through it actually 7 times. Um, I have 2 children,
Mm.
and I didn't think the second time I got pregnant that I would have a miscarriage. Um, and I always knew when I was pregnant. I actually, yeah, it was like clockwork. 5.5 weeks, boom, it started. And I
Oh
always knew when
gosh.
my pregnancies weren't going well because the nausea would
Mm.
sort of, and the vomiting would sort of start disappearing, and I would start feeling better. And I
Mm.
always knew. And people were saying, "Oh, each pregnancy is different, and
Yeah.
this is it's good." And I always knew when it wasn't going well.
Yeah. Were you anxious about having another child because of what
Yes,
you went through? I mean,
yes,
that must have
yes,
built up a lot of anxiety.
yes,
And did you ever think, actually, do I really want to do this again in case this happens to me
yeah,
all over again?
yeah,
Because there was no solution.
yeah, yeah,
You know,
yeah,
it wasn't like a doctor saying, you know, don't worry, if you do want to have kids
yeah.
again, we will give you this
Yeah,
and it will stop.
exactly, exactly. So, funnily enough, after I'd had my daughter, and at some point, and I think most women go through this, they have their health check at some point after
Yeah.
having a baby, and your GP typically is the one you see, and they ask, what about contraception? Are
Yeah.
you thinking about having more children?
Yeah.
And I remember saying to him, uh, that I think the only way that I can survive another pregnancy is for it to happen and it's not planned. And then, of course, it happened that way, and when I miscarried, I realized that if I was going to survive another pregnancy, it would have to be planned, in the sense that I would have to have a setup, because the minute I got pregnant, I couldn't take care for my daughter.
Yeah.
And she was about 20 months the first time I got pregnant.
Mm.
But mostly I was just really, really, it's going to sound very horrible, because obviously there are two, I mean, both my husband and I, we'd agreed that we would have 2 children if we could. But somehow I got so angry when I was pregnant, because I thought, well, you don't just get pregnant like that.
Yeah.
It doesn't happen like that.
Yeah.
But it did.
Mm.
And yeah, just being so ill was just not fun.
Mm.
And yeah, no, the anxiety. But after that first miscarriage, I did go back to my GP, and I did say, yeah, the not planning it didn't that didn't
Yeah.
really work, did it?
Yeah.
So for the future ones, it was more of a plan, in that I knew that I had someone who could come and help me with my daughter, particularly on at times when my husband was working,
Yeah.
and um,
Of course, your family are in Sweden.
exactly,
So
and his
it's
family is in the
even,
US. So
yeah,
we
you need
just didn't
it.
have that support. We had a wonderful part-time nanny,
Yeah.
but he was working weekends at the time, in the position he was working at the time. So weekends I was sort of a solo mum for almost 10 years,
Mm.
and that was, I just could not care for her when I was on
Yeah.
my own.
Yeah.
But it's a funny thing with miscarriage, I think, because well, for me at least, so it happened the first time, and we all hear that miscarriages happen more than we maybe realize.
Mm-hmm.
But if you look at the stats again, you can see that it's really quite common.
Mm.
So the second time I got pregnant, I was like, okay, this is still got ill with a hyperemesis, but then I lost that baby as well. And at that point, I think it my brain, I got a bit obsessed with trying to figure out why. And of course, half of the time there is no reason, as in that it's the body naturally, there is something that the baby isn't, the fetus isn't viable.
Yeah.
So yeah, got pregnant again, and then again, and then the pregnancy before my son, everything was going very well. And again, obviously hyperemesis, but
Was that with every single
yes,
pregnancy? Right.
yes,
So you knew what was
yeah,
coming.
I knew what was coming. And that, I think, was the only good thing about having had it enough times, was that I knew exactly what was going to
Yeah.
happen. So I
Yeah.
learned as I went along, in a way, what not to do,
Mm.
and what to do, and
Mm.
starting meds immediately, not trying to do things because that would just make it worse.
Mm.
But we found out that the baby I was expecting wouldn't survive outside the womb.
Wow. Gosh.
So that was yeah, we had to we had to abort we had to finish the pregnancy,
Mm.
which was very, very difficult.
Yeah. Yeah.
And it's one of those things that I think a lot of people have opinions about it, but you will never know how you will feel when you're actually faced with having to make a decision.
Mm.
And on the one hand, it was the easiest decision ever, because there were fears for me,
Mm.
but also it was a question of, will the baby die during pregnancy, which was very likely. So the longer you go on, the more likely, or at best die during childbirth, or die as soon as it's been born.
Yeah.
And you have also a child who is alive.
Yeah.
And
That's difficult.
I mean, it was a
Yeah.
horrific thing to be faced with.
Yeah, absolutely.
And to know, and I remember feeling, if just knowing that, I've got
Yeah.
something I've got a baby in my tummy.
Yeah.
And the only reason that it's moving, it's because of the amniotic fluid.
Mm.
Um, and yeah, it was really, really
Mm.
hard.
You talked about, with the first pregnancy,
Mm,
you had depression whilst you were pregnant,
yeah,
but no one knew,
yeah,
and it wasn't, the I guess the medical professionals didn't catch it and
yeah,
didn't notice.
yeah, yeah,
Um, so that's one, obviously, that's one problem.
yeah.
But when you were going through the pregnancy and
Mm.
did you feel that there was something wrong yourself, or did you just think it was kind of part parcel of being pregnant?
It's a really good question. I think that when you are so ill with something physical,
Yeah.
and and also had a lot of pain with back pain and incredibly severe sciatica. I could barely
Yeah.
move. So when you have the combination of the physical pain, but you're also being sick so much,
Mm.
a lot of the time you don't actually even realize what's happening
Mm.
because it's your kind of thought constantly is just to survive the day.
Mm.
Um, so I didn't realize myself what was happening, and it's only I got diagnosed retroactively, um, and but at the same time, I think I'm just really shocked that it wasn't picked up
Yeah.
on because, or that no one asked or looked into it because it was just because of how incredibly ill I was.
Yeah, but it's almost, you feel like it's a simple question. You're going through all these physical
Yeah,
problems,
yeah,
okay? Not once, no one asks you, "Are you okay?"
yeah,
"How are you
yeah,
feeling?" Because
yeah,
that
yeah,
often sets off
yeah,
something
yeah,
inside you. Perhaps not everyone,
yeah,
but,
yeah,
"How am I feeling?" "Actually, I feel like this and this, and, this
yeah,
is, these
yeah,
are my thoughts, and
yeah,
this is,"
yeah,
and then perhaps it could have got picked up.
yeah,
But it's almost a case of you're just being treated for, being sick,
exactly.
and that's it. But
Yeah,
there's no kind of psychological
yeah,
help
yeah,
or support
yeah,
there, or even the
yeah,
question, because anyone that goes through any physical pain,
yeah,
or any
yeah,
disease really
yeah,
that's quite big,
yeah,
they must be going through something psychological. There might not be, but that,
yeah, absolutely.
in my opinion, I think the chances are quite high.
Yeah,
So it's almost like this should go hand in hand,
yeah.
you know?
Oh,
And then
absolutely.
obviously with pregnancy
Yeah,
anyway,
yeah,
the chances of having depression and postnatal depression
yeah,
is there anyway. So
yeah,
that should have kind of
yeah.
got picked up.
Absolutely. No, exactly. I mean, in hindsight, I'm always shocked at
Yeah.
how, yeah, like you said, I think that main focus was just on the physical
Mm.
and okay, let's get her to survive it, so to
Yeah.
speak. But I remember as well afterwards, around 2 weeks after my daughter was born, um, I started spiraling into really, really severe postnatal depression and
Mm.
anxiety. And I think I was very close to it being a lot more severe than that.
Yeah.
I had a lot of voices in my head and a lot of intrusive thoughts and a lot of. I remember I'm seeing the bookshelves behind you, and I was convinced that they would topple over and kill my daughter,
Oh
like
gosh.
constantly, and I
Yeah.
couldn't sleep because I was just terrified that the bookshelves
Yeah.
would topple over.
Mm.
And equally, I think, oh yeah, and that's the other thing. My breastfeeding wasn't working. She wasn't putting on any weight at all. And
Mm.
everyone just kept saying, keep feeding, keep feeding, keep feeding. Her weight was just
Yeah.
dropping, and she was clearly hungry. She was really, I felt like she was really angry with me, and I felt like during pregnancy, my body wasn't fit to be a mum. And then now I have this baby and I can't even give her what every woman should be able to give,
Yeah. Yeah.
breast milk.
Mm.
And I remember a health visitor who wasn't mine. Mine was on holiday, so someone else sort of stepped in, but they didn't see me in person and they called me. And I remember crying on the phone and saying, I just don't know what to do. My milk is just not, she's dropping in weight, and I am feeling like suicidal. And the person said to me on the phone, I remember the words, it's a slippery slope. Just essentially don't feed formula. Just keep offering the breast.
Oh gosh. Yeah.
And I also I also ended up with an infection in the womb, so I had to go off and have an ultrasound, and I had to be put on antibiotics. And by that point, it was a month after she was born. And I remember about to cross the road and having the thoughts of, you know, my husband and my daughter will be much better off if I'm not here, because I'm clearly not cut out for being a mum. And cars were just whizzing past, and somehow though I made it home, but I realized that I need help. So we had someone who was very kindly helping us at the time, just and she also noticed that I wasn't going in a very good direction, so she had been sort of subtly kind of trying to get through to me. And I booked in with my GP, and I was diagnosed with postnatal depression. And they actually said, you have to stop breastfeeding because you need to go on very strong antidepressants that are not compatible with feeding, with breastfeeding. And by 6 weeks, I think it was, or 5, something like that, she was on formula. And that's when I was able to start bonding with her. She was finally getting fed, started putting on weight. But it was very scary. And just I still remember very vividly just being at the edge of the road and thinking how easy it would be.
Yeah. See, I mean, this is the thing, people have this view of pregnancy as, oh, I'll just get pregnant and hopefully, and then, go through the motions. But pregnancy actually, it's a huge thing. It's not, I mean, you're carrying life. There's all sorts of complications that can go on with your body while you're pregnant. I mean, some women don't have any complications. Some women have it mild. Some women have it severe. But you can't plan for that.
No.
You will never know.
No.
Yeah. And it's not just going through the motions of being pregnant. Then there's the depression. Then the mental side of things, the physical side of things. Giving birth, can be quite
that was
traumatic.
Probably the only easy thing.
Yeah.
Even though it was 26 and a half hours long, 3 midwife shifts. But
but it's probably easy for you because you've been through so much. And that was probably a breeze for you. For someone that's not been through anything at the beginning and then goes through childbirth, that's probably like, oh my God, it's, this is like really painful or whatever,
Giving
however they
birth
feel.
was literally, I remember, obviously when you're in it, it's painful.
Yeah.
And I opted for no pain relief at all.
Oh wow.
So but that was me.
Yeah.
Being crazy. But
Well, you're probably
but
fed up as well of being pumped full of drugs anyway,
yeah,
and you're
yeah,
probably just
probably.
thinking,
I hadn't thought of it that way, but yeah,
I just want to do something that's
yeah,
just more natural,
yeah,
more, the
yeah,
normal process.
yeah. But for me, I think the overriding feeling was like, this is actually ending now. And I
Mm,
think it felt like liberation.
yeah.
With each contraction, it's like I'm
Mm,
actually getting closer to being out of this place of hell
yeah.
that was my pregnancy.
Yeah.
Um, yeah. And I think the only, not the only good thing, but one of the good things about having gone through what I did and then in the subsequent pregnancies as well was when I finally got pregnant with my son in 2013. I had the most incredible help from the hospital.
Yeah.
So I was very stoic about going into for my booking an appointment. I'd been to the hospital so many times with all my pregnancy thing, miscarriages in between, and I'd had to have so many D&Cs there as well. So I yeah, it was an evening appointment, I think, and my husband was at home with our daughter, and I was like, I'll just go to my on my own. It's
Mm,
not a biggie. It's just the booking an appointment. By that point, I knew exactly that it was sort of the booking an appointment is quite
yeah.
anticlimactic in a way.
Yeah.
So I got there, and the minute I saw the midwife, I had a complete breakdown because everything that had happened up until then, and particularly uh, the year before when I'd been in and we'd had those horrible news about the pregnancy that didn't end well. Um, yeah, it all came flooding back to me.
Mm,
And it was also, why is this going to go well? Nothing else has gone well.
yeah.
Um, and also, actually, by that point, I'd already been admitted to hospital with hyperemesis on drips and stuff. So I
Mm,
was admitted at 8 weeks with my son. And yeah, but the hospital they were absolutely amazing. Not only I didn't even have to ask the midwife, and I still remember her name, Carol Pitterson, um, asked if I wanted to be seen by the mental health team. And a week later, I had my first appointment. And she referred me on to the fetal medicine unit, where I had additional scans
mm,
alongside my sort of regular antenatal
yeah.
appointments up until about 20 weeks. And they were absolutely amazing. And actually, one of the reasons I felt that I could try one last time was the previous year when things had gone so horribly bad.
Mm,
They were incredible. They were so supportive and they were so sensitive with
yeah.
everything that what I went through,
The whole process.
the whole
Yeah.
process.
Do you think that's because they knew what you'd been through before, or was it because was it a new case? That it just happened to be obviously new staff, new people, but obviously they know your history, right?
It was actually one of the main sonographer. I think the main sonographer at
Mm,
the fetal medicine unit. He had seen me during the pregnancies that didn't go well,
yeah.
and so he knew me. He remembered me, and which was really wonderful as well because he kept reassuring me about looks nothing like
Mm,
a year ago.
yeah.
Um, but having that support and having the mental health support was, I can't tell you the difference that it made.
Yeah.
And by that point, once my son had been born and the pregnancy did go well, it ended up, we almost lost him during birth. So
Mm,
it was very scary. It was one of those pregnancies, or rather labors, that it was very quick, and everything was going really well, and then
yeah.
suddenly it didn't go. It was
Yeah.
the alarm bell was pushed, and the room was flooded with people, I didn't know whether I didn't even realize that he came out in the end, and I didn't hear him cry, and I didn't know whether he was alive.
Yeah.
But we were extremely lucky, and the midwife was, I mean, we were so lucky.
Yeah.
But once I came back from hospital and we were kind of discharged and put onto the GP surgery team, they had lots of extra support for me,
Yeah.
which was obviously very, very good. I just wish that it had happened the first time around.
Yeah. But then, this is my whole point, it's advocating for yourself
Yeah.
and having the knowledge.
Yeah.
Not to scare, there's so many things that with pregnancy, there's so many things that can go right and there's so many things that can go wrong. It's a
Yeah.
complete unknown, and
Exactly.
every woman's body is going to,
Yeah.
be different. Every woman's experience is going to be
Yeah.
different,
Yeah.
but it's a complete unknown.
Yeah.
I was worried when I was pregnant with
Yeah.
my first
Yeah.
because my mum had what you had.
Oh, really?
Yes. And not to that extent,
Wow.
but she couldn't keep anything in throughout the whole pregnancy, and she was going to work as well every day.
Wow.
And I was born as a C-section. I was born earlier. Well, actually, no, not. I was born late. I just refused to come out.
That was like my daughter.
Yeah, and
She was very happy.
yeah, and I was very low birth weight.
And low birth weight is
Yeah.
another indicator.
Because my mum could not keep anything in, and of course she couldn't breastfeed.
Yeah.
So I was, brought up on formula.
Wow.
Yeah.
Yeah.
And
I always say fed is best, by the way.
yeah, I was fed on. Yeah, exactly. Sorry, fed. Yeah, absolutely. Yeah. So when I got pregnant, in my mind, I was thinking, is this going to happen to me?
Yeah.
Am I going to get the same, and I didn't.
Yeah.
I had the typical pregnancy
Yeah.
of, nausea for the
Yeah.
first 3 months, and then, blah, blah, blah.
Yeah.
Of course, my first was a emergency C-section. I was in labour for a crazy amount of time, and then, but yeah, so I just think, I don't think people understand the complexities of pregnancy, and it's true, what happened to my mum didn't happen to me, so mine was a very different scenario. With you, was there anyone in your family that had what? Right, okay.
Yeah. No, it's a funny thing you ask, because I remember very vividly the first time I was admitted to hospital. My maternal grandmother was visiting my mum at her house in Sweden, and my mum had called to ask how I was, and and she could tell that I wasn't well, and she kept saying to me, "You need to go to hospital." And then that day, later on in the evening, was the day when I collapsed. And when I a few days later, when I was still in hospital, hooked up on the IVs and stuff. And my mum was checking on me, and I remember saying to her, "Just tell grandma that I'm pregnant, because she obviously knows that you have said you need to go to hospital,
Yeah.
and she'll be worried." So she said, "Look, I will." And then she called back within seconds, and she said, "Oh, grandma had the same thing." She had no idea. No one knew that my grandmother had hyperemesis with both her pregnancies. But just like your mum, she managed to, I can't remember whether she had to take time off work, but
Yeah.
she sort of was managing.
Yeah.
But I don't think that she was on any medication. I don't think that
Yeah,
any
my mum
women
wasn't.
weren't
Yeah.
given any medication, or
Yeah.
that they weren't even trying on any
Yeah.
with anything. So
It
to
was
speak.
almost kind of seen as normal, and
Yes.
I mean, I don't think my mum's was as severe as yours, because if it was, obviously, I'm sure she would have ended up in hospital.
Yeah.
Because that's very severe.
Yeah.
And there's different
Exactly.
extremes of it.
Exactly.
So it's not,
Exactly. But yeah, no, so I had never heard of Hyperemesis Gravidarum until that day when we went to the GP and I got the pill that I vomited up immediately, and then ended up
Yeah.
being admitted that same evening.
Yeah.
I'd never ever heard of hyperemesis until I was admitted to
Yeah.
hospital, and then to find out that actually it runs in the family, so to
Yeah.
speak, but it had jumped my mum's
Yeah.
generation.
Yeah. Yeah. Gosh, I hope it doesn't jump if my kids ever
Yeah, but at least
decide
you
to.
know,
At
and
least I know.
you can be on the lookout for it and talk to them
Exactly.
about it.
So this is the key, and I think it's so important that generations pass down this information,
Yes.
and that we now, okay, I didn't know my mum had this, obviously,
Yes.
until even, like, I don't know, maybe in my 20s at some point, we had conversations, and only now we have conversations about lots of different things, and I
Yeah.
really find out
Yeah.
the deep-rooted history of my
Yes.
mum, and
Which is
certain
amazing.
things, which is not, not to do with health, but
Yeah,
just
yeah,
generally,
yeah.
But we don't have these conversations, and it's so
Yeah.
important, especially with health. It's so important to inform, make sure your children know about what you went through with
Yeah.
whatever, whether it's psychological,
Yeah.
pregnancies, some serious diseases,
Yeah.
diseases about that your family had,
Yes.
and just make them aware,
Yes.
perimenopause,
Yes.
menopause,
Yeah.
all these things, they all, the girls and boys should be aware of it all, right? Just so that hopefully they know,
Yeah.
they've got that knowledge,
Yeah.
they can advocate better
Yeah.
than what we
Yeah.
did, and they can push back and say, no,
Yeah.
actually, this is, I want to be seen, I want to be referred.
Yeah.
I'm not coming back in a month.
Exactly.
These kinds of things you need to push
Exactly.
back on, right?
Exactly.
It's so important.
It's so
yeah.
important. I couldn't agree more.
Yeah.
And I think it's one of those things as well when you've been dealt a number of quite challenging things
Yeah.
in life, and where your life looks very different from how you imagined it to be, and where, I mean, I don't perform anymore because it just I can't
Yeah.
with my long COVID, but also with it's just I mean, most of my performing was touring, which is also not very compatible with having a family, but I think it's hard when at times when your life does look very different from how you imagined it to be, but learning from the kind of challenges that you are living with, and trying to improve not just life for yourself, but hopefully for others as well, by advocating. I mean, I'm absolutely passionate about advocating for HG, and I personally noticed a big difference because I was pregnant with my daughter before the Princess of Wales, Catherine, was pregnant with George, and she had she has hyperemesis with her pregnancies.
Okay.
And I noticed a big difference with my pregnancies after she had been pregnant with Prince George, because people would go, "Oh, isn't that what Catherine Middleton has?" And so that I found helpful in a way, because it was a little bit more out in the open, as it were, and people at least had sort of heard of it.
So you mentioned long COVID. Now, fast forward.
Yes.
You've had your pregnancies, as in you've got your children, and then obviously COVID happens, and now you're hit with long COVID.
Yes.
Now, again, this is something that isn't really talked about.
Yeah.
And some people don't even know they have it.
Yeah.
Right.
Yeah.
Again, it depends on extremities.
Exactly.
So,
Exactly.
there's a range. It's not just long COVID and this is it.
Yeah.
Can you talk briefly about that?
Yeah. So in March 2023, so actually in February 2022, I got COVID the first time, and on day 2, I had some breathing issues. My asthma got quite a lot worse. But what happened was I got debilitating vertigo and dizziness,
Wow.
where
Gosh.
I actually couldn't walk. I had to crawl around at home with my eyes closed. And I had that for a few months, and it sort of gradually improved, and I felt okay. I think after about 6 months, I was like, okay, I'm back on track.
That's a long
So,
time.
yeah,
That's a very long time,
yeah,
really. You
yeah,
know.
yeah, yeah.
Yeah.
And then fast forward to March 2023, I get COVID again. Day 2, like clockwork, the vertigo hits. So yeah, that was me again, crawling on the floor.
You're very clockwork, aren't you?
I am very clockwork, actually. That
I
is
just
very.
noticed
It's
that pattern. Like,
yes,
you know.
but it was funny. Day 2.
Yeah.
It's
I mean,
yeah.
we laugh about it now, but it's
No,
obviously
well,
it's not a
exactly.
joke.
I've never
Yeah.
thought of it before, but
Yeah.
it's very true.
Yeah.
Very true. And yeah, and essentially, it's now November 25, and I'm living with long COVID, and the first, I'd say 9 months were really, really hard. Again, it was sort of stages. So the first few months where I struggled to leave the house, I had great difficulty moving around inside because of the vertigo and the dizziness. Everything was literally spinning.
Yeah.
And when I lay in bed, I felt like I was falling down through the bed, just everything spinning. I couldn't talk to people
Yeah.
because every movement that you make, whether it's just, like your eyelids blinking
Yeah.
exactly, would set off my it would make my vertigo worse.
Yeah.
So I spent many months at home, just trying. I had sunglasses indoors to manage, and then I actually got prescribed some specialist lenses that are coloured, that help sort of with the vestibular overwhelm. So it seems like for me with my long COVID, it's gone down into my airway, so my asthma has worsened a lot. But it's sort of affected my vestibular center,
Yeah.
which is the balance and movement and all those things. And funnily enough, that very much kind of relates to with the COVID, with the hyperemesis.
I was just about to say, I can see a link.
Yeah.
Because it sounds like when you had that, with movement, you were throwing
Yes,
up.
exactly.
And now
exactly. Exactly.
Yeah.
Yeah. And so just to sort of put it into context as well, because it's interesting. After my first hyperemesis pregnancy, so I've always had motion sickness, but after my first hyperemesis pregnancy, I struggle with things that are moving quickly on a screen. I can't scroll on my phone because it actually gives me,
Oh, wow.
it makes me dizzy
Yeah.
and nauseated. So, and that's since my hyperemesis pregnancies. And so, so the most challenging part of my COVID has been how it's affected my vestibular center. I am now much, much better, but I have to constantly be alert. If I'm tired, if I'm not sleeping well, if I'm dehydrated, if I'm hungry, if I'm stressed, anxious, it can be one of those things, or it can be a few combined, or it can be all of it combined. I am more sort of at heightened sort of long COVID state.
Yeah.
That's sort of how it feels, and it's probably the easiest way of explaining it. And so for instance, walking downstairs, I always hold on, but I can physically feel my balance being less good. And so I hold on, and even, crossing the road with
escalators?
Escalators, actually. It's
Gosh,
it's a really good thing you asked, because I fainted once. I was doing okay, and then I went down an escalator, and I literally was,
oh gosh. Yeah.
and then I was gone for days. As in, obviously I came around,
Yeah.
but the effects last for
Yeah,
days,
yeah.
where I just have to be horizontal, and I struggle again with talking to people. So yeah, I could talk forever about it.
Yeah. Yeah.
But it's very frustrating, because it's a daily a challenge.
Mm.
And like today, I'm feeling actually really good.
Mm.
But for instance, last week, I had every single day last week, I had sort of borderline blackouts.
Mm.
I was
Mm.
walking my dog, and then suddenly everything just went black for a split second and
Yeah.
turned upside down.
Yeah.
And I could feel my balance.
Yeah.
It's like, ooh, this is not good. So I had that every day last week,
Yeah.
once a day.
Gosh. I guess, these are things we don't think about, the after effects of COVID. And, for some, you may think that it's, like I said, that, there's extremities, but
Mm.
some people might have a very mild form of the after effects of
Yeah.
COVID
Yeah.
and just ignore it and think, oh, it's just this,
Yeah.
or this
Yeah.
is just whatever.
Yeah.
Yeah,
Yeah.
but it's almost like when it's mild, you'll never really know.
Yeah.
You know you have long COVID
Yeah.
because yours is fairly extreme,
Yeah.
right? So it's these things that we have to, again, advocacy,
Yeah.
knowing these things,
Absolutely. Absolutely.
and you've just been talking, and I've just kind of in my head put the dots together
Yes.
with
Which is incredible.
yeah, and I just thought, hold on a minute, there seems to be a link here,
Yeah.
and yeah, but it's amazing how there is a link,
Yeah.
but there's no cure.
Yeah. No, and I think that's the thing. And actually with both the hyperemesis and the long COVID, I mean, obviously there's a lot of medical advances in research
Yeah.
With hyperemesis, and I know with the long COVID, there's a lot being done. I am
You do a lot of work with women's health, don't you now?
I do, yeah. No, I'm very passionate about
Yeah.
it. No, I'm hopefully I'm just waiting for I'm going to be enrolled in a long COVID study.
Mm.
So I'm just trying to help in any way I can,
Yeah.
because I think the challenge of a lot of these things that I'm living with is that they're invisible.
Mm.
So you may look at me and it's like, well, you don't look ill.
Yeah.
Whereas one of the reasons, obviously, this happening was delayed is because I had a fall,
Yeah.
and broke my wrist and needed surgery, etc. And having gone through that and seen the kind of how people respond differently because it's something physical
Mm.
versus something that you can't really see.
Yeah.
Obviously, you can see it if you're seeing me um, when I'm really bad, but when I'm really bad, I don't leave the house because I
Yeah.
can't.
Yeah.
So it's people don't see it, and it's like, oh, you look great.
Yeah.
You don't look ill.
Yeah.
But it's that constant daily. I mean, the fatigue as well. The long COVID fatigue is.
Right.
I I I think it's very similar to when you're first pregnant. That's how I kind of think about it or explain it to people. And women obviously get it, but that you're so tired you could literally fall asleep standing up. And your brain it's like your brain sort of shuts off.
Yeah.
Because it's just the fatigue.
Yeah.
And that's almost my daily, that's how I wake up
Yeah.
these days. And the routine, I have to have the routine. I can't do evenings at all. I cannot function, which is one of the reasons why it's highly unlikely that I will be able to go back to performing, for instance, because I cannot function if I don't have a routine that is predictable.
Yeah.
And at times it's so frustrating. But it is what it is.
Yeah. Yeah.
I can't do anything about it. I can only try and do things for me that will make my life better, and then ultimately obviously make it easier for my family and so on. But I think for me the most important thing is trying to advocate for those who also suffer from it, and obviously with hyperemesis as well, and the mental health challenges that come with that.
Yeah.
Because it's very hard when things are invisible.
So you've built an amazing community,
Yeah.
and And this is another thing I really want to touch upon, because I feel like throughout this whole thing, everything you've been through, with the pregnancies, with COVID, I just want to ask you, I know you've built a community in
Yeah.
between, after the pregnancy. Was it after the pregnancies you built the community?
No, well, yes and no. So I started setting it up, obviously not officially at all,
Yeah.
but I started organizing coffee mornings in the kind of summer, late summer of 2009. So my daughter was born in April of 2009, and I found myself, despite um despite the postnatal depression, and I remember going out and feeling like I had this neon sign saying she's a freak, like she's got postnatal
Oh,
depression.
no.
And I was really scared of going out on my own because I felt like such a failure,
Yeah.
and I felt like everyone else was had it all kind of
Yeah.
organized and they were
Yeah.
perfect, etc., and
Yeah. When
they
you
didn't
see other
suffer.
mums and you
Yeah,
start comparing yourself and
yeah.
you think, why, they seem like
They've got it
they
all sorted, and it's
exactly,
like
and
they
that
know what they're
yeah,
doing.
and they don't look unhappy, and everything's,
Exactly.
100% perfect. And that's like a bit like social media, right? You look at people
Exactly.
and you just think, oh, look at,
Wow,
wow,
what a
look at
life.
what a life they've got. But behind the
Exactly.
scenes, you actually don't know what's going on
No,
with a lot of these
exactly.
people. I'll say people, men
Exactly.
and women,
Yeah.
right?
No, so true.
Anyone.
Yeah. Yeah.
So yeah.
So I found myself, I remember the words coming out of my mouth. It's a really long story, but I'd ended up on this mailing list, NCT, although it didn't exist in our area at the time, and had ended up on this mailing list, and an NCT coordinator had set up a meeting but wasn't there. So it was sort of a bit odd, but there were a bunch of us there, and I found myself, I almost didn't go because I was so scared of going out being a freak. And I found myself saying, we should organize this more often. And then I started doing it
Yeah.
every Friday at 10 o'clock. And for me, that was very much sort of part of my own lifeline of once a week. I knew I had to be somewhere,
Yeah.
and I had a reason to go out. And sometimes it was just me, and other times there were a couple of others, and other times there were like close to 20 of us. So, and then I started sending out these emails to those who were sort of the regular group, and
Yeah.
then others came along, and others. So sort of gradually from then it built up on its own in a
Yeah.
way. And then in March of 2013, there was an event going on, and I'd been asked to sort of be involved in it locally for families. And I decided that I was going to create a website, because everyone who was part of my little mailing list had said, why don't you create a website or a blog of some sorts? And I had that, I got that up and running. And that was the first NW8 Mums
Yeah.
website.
Wow. And now you've got this huge community.
Yeah.
That's
Which
amazing.
is,
It's amazing how things start from something so small, and then you realize actually that, people actually want this, and then it just
yes,
grows and grows and
yes,
grows.
yes.
Yeah.
No, and I think for me, initially it was a little bit sort of self-serving, in the sense that getting the coffee mornings going, it was really for me I wanted to try and find others to have coffee with, and also for, to go to the park with the
Yeah.
children and so on. But, and I was always very open about my own experiences.
Yeah.
And I wasn't necessarily able to be open about them when they were happening, but I was able to kind of be open about them afterwards.
Yeah.
But I just felt this really huge need to connect people, and to make them to make other women in particular, because it was mostly women who were turning up, to make them feel less alone and
Yeah.
isolated. And I think, the kind of foundation of it was, I don't want anyone else to have to go through the isolation that I experienced, regardless of whether you not that many women will have hyperemesis, but you may struggle in other ways. And I think a lot of families, a lot of people in London, particularly central London, come from elsewhere. So a lot of us don't have support around. So it's sort of, that village and having that support and knowing that you can be open about things and you can ask someone about something. And creating that village and for me, that support, the foundation of support was always the most important thing, and it still is.
For me, I just want to point out that I think it's so important that, community, finding that social connection and finding a community that you feel like, you can resonate with or belong and share experiences with, and really, finding that thing that kind of lifts you up. And also, secondly, check in on people. It's so important. People may look like there's nothing going on. Because, a lot of people want to put on a brave face for whatever reason.
Exactly.
But you just never know. And when you ask people questions like, how are you? Are you okay? It can do wonders.
Absolutely.
It really can do wonders. And I think that from this conversation, I think that is one of the key takeaways, really just check in on people. And, like you said, with the whole invisible, you don't know what people are going through. Everyone, goes on with their,
Smile
perfect little
and
lives.
Exactly.
Looking like they're having a perfect life. But behind closed doors, there's lots of struggles that go on, especially these days.
No, exactly.
It's hard. But Karin, thank you so much for
No,
sharing
thank you
your
so
very
much.
personal journey. And I think this topic, about pregnancy, that all the intricacies with pregnancy is so important. But thank you. And also your community. It's a wonderful thing you've created.
Thank you.
Absolutely wonderful. Thank you so much.
And thank you so much, Rhea, for having me as well.
It's
been
absolute
really
pleasure.
Wonderful.
Pleasure.
Thank you.